Madam Secretary, I'd like to kind of go back to the earlier questions I was asking about what I consider just really understated cost estimates for the Health Care Act. You know, back in the 60s when they passed Medicare, they projected out 25 years and said that Medicare would cost $12 billion in 1990. In fact, it ended up costing $110 billion, almost 10 times the original estimate. And you know, my concern is our federal government hasn't gotten any better at estimating costs. So, you know, you had mentioned when I started talking a little bit about the incentives embedded in this bill for not only employers to drop coverage, but now it's for employees to want to get into the exchanges because there's such high levels of subsidies. You talked about that being cynical. I'm trying to be realistic. And I'm not the only one, I think, that has that same viewpoint. Douglas Holtz-Aiken, a former CBO director, has issued a pretty good study where he's talking about a very detailed decision matrix that pretty well shows that it's in the employer's best interest and the employee's best interest for about 35 million people to take advantage of those subsidies in the exchanges. And yesterday, I believe the Hill reported that Joel Ario, I believe, I'm not sure I'm pronouncing that right, but he's the head of the Health Insurance Exchange Office within your agency, was quoted by saying that if exchanges work pretty well, then the employer can say, this is a great thing. I can now dump my people into the exchange and it would be good for them and good for me. And that's just what I want to explain. Again, the decision that an employer is going to be going through is I can pay $15,000 a year to provide health care coverage, or I can pay a $2,000 penalty, and by doing that, I'm making my employee eligible for, in some cases, in excess of $10,000 in subsidies. I mean, right now in 2018, according to the way that the health care bill is written, in 2018, a family that earns $64,000 will be eligible for a $10,000 subsidy. And, you know, let's face it, when the federal government offers subsidies, they're generally taken advantage of. So I think it's just totally unrealistic to expect only 3 million out of 180 million people take advantage of those subsidies. And my question is, what happens if I'm right? What if Douglas Aiken's right and it'll be at least 35 million or even higher? For every 10 million additional people, it's going to cost $50 billion in additional costs, and that's 33% higher than the original cost estimate for this Health Care Act.
Well, Senator, first of all, the Affordable Care Act has a ban on large employers even considering exchanges for at least the first 5 years. So your scenario in 2018 for large employers is not a possibility because they would not be eligible to enter into an exchange. And I think the ban is written in such a way that Congress will reconsider at the end of 5 years whether that should indeed be extended. And the vast majority right now of stable coverage, at least in the employer market, is in the large employer area. Secondly, I think that while there are a whole variety of scenarios, what I know about the existing market is that small employers have been abandoning the market altogether. The trend rate for the last 10 years has been sharply downward. So employees who either are self-employed or farm families or working for a small employer are less and less and less likely to have any affordable options and therefore are shopping on their own in what is a very fragile individual market. So the trend rate is not good at all. I think there are, again, some very optimistic opportunities in creating state-based exchanges where small employers for the first time will have the pooling flexibility that their large competitors have. They will have an opportunity to essentially shop without a very sophisticated HR department in a pre-designed marketplace, and will have the benefit right now of tax credits that we're seeing for the first time in a very long time, bringing some of those folks back into the market. So I think the large employee marketplace will stay relatively stable and stay fairly much the same, although hopefully their costs will go down as the CBO predicts. And the small marketplace, which has been disintegrating dramatically over years, will again be stabilized.
What is the definition of a large employer? I mean, what is the definition that will be excluded from these exchanges?
I think the large employer is 100 or more employees.
Okay, thank you.